Okay, so addressing pain as we age, session two. Addressing pain as we age, session two. Awareness of diagnostic markers we'll be covering, and understanding and implementation of lifestyle interventions. So let's look at diagnostic markers, clinical indicators in chronic pain and inflammation. So if you are in pain or potentially you had pain in the past, there could be reasons why you were in pain that you may not have been aware of, or you may have. So let's look at these factors. Okay, so in blood tests, there's something called C-reactive protein. Okay, and I told the story with personally with myself there that I had very high levels of that, and I had pain, basically severe joint pain. But this happens in acute inflammatory conditions, which can relate to infections, joint pain, autoimmunity, folks with inflammatory bowel disease or rheumatoid arthritis. So that's something you'd want to have checked, especially if you're in a lot of pain, is C-reactive protein. And if those numbers are high and you are in pain, there's something called curcumin, supplement-wise, that can be very helpful to help minimize your pain. And again, I tell the story that I had steroid shots under X-ray, but nothing was touching the joint pain, the hip pain, until I started taking curcumin. And within just a few weeks, I was back on my feet. Okay, next is called erythrocyte sedimentation rate, or ESR, or SED rates. You may have heard that. And these are SED rate, usually you probably have had that test done if you've had blood work done. But this can relate to high levels related to chronic inflammatory conditions, autoimmunity also, or kidney disease, like chronic conditions. Thyroid antibodies, something called TPO, thyroid peroxidase antibodies, or thyroid globulin. These are autoimmune thyroid disease. Autoimmune thyroid disease is a recognized cause of, say, fibromyalgia and chronic widespread pain. So a lot of times doctors may check your TSH for your thyroid, but if you are in pain, you want to ask for a thyroid antibody test, which can tell if your body basically is attacking itself, which can cause pain. Again, if you have some questions, hold your questions and we'll field them afterwards. Vitamin D, autoimmune relationships also. People who have low levels often have joint pain. Okay. Autoimmune relationships too. Now with vitamin D, it has a lot to do with helping your intestine be as healthy as possible. And if your intestine isn't as healthy as possible, things can get into your bloodstream that can cause inflammatory reactions. Homocysteine, which is a cardiovascular inflammation marker. Higher levels are associated with knee osteoarthritis. So a lot of times it's used to look at the cardiovascular system, but it's been found that folks who have high levels of that have related this to knee pain or knee osteoarthritis. And homocysteine is tied in with B6, the vitamins B6, folate, B12, and these are related to DNA methylation relationships here. And methylation, it's a big term there, but it relates to inflammation. So if your body is compromised with methylation genes there, then you're looking to see what folate or what type of B12 may be helpful for you, can actually help reduce or address that inflammation related to homocysteine levels. I know I gave you a little mouthful there, but then we can review that afterwards. Uric acid. So uric acid for folks who've had gout in their feet, ankles, knees, hands. So again, you want to see. Now, a lot of times those uric acid levels can be rising before you may have an outbreak of actually gout pain. So that's something to track there. And if you are in pain with your feet or ankles or knees, it's good to actually check your uric acid levels. Neutrophils and lymphocytes. These are involved in acute and chronic inflammation. So there's ratios between the two, but those are white blood cells. And if your body's actually weathering and say an infection, which can cause inflammation, which can maybe make your whole body feel sore. High monocytes. Now, monocytes are also related to white blood cells. And if those are high, and when you have a CBC taken, you've probably heard of that, they always check monocytes. But if those are high, it could be a flag. You may have a food sensitivity inflammation, which can relate to inflammation, which could relate to possible joint pain. So that's something to see, take note of. Self-test pH. Now, a simple little test you can do for yourself is checking your pH, your saliva or your urine pH, and that tells about acid alkaline balance. And if your body is running acidic, too acidic, you'll feel basically that stimulates what's called your sympathetic nervous system, which can create more acidity in your system. And the higher the acid levels, the more your nerves may be irritated, which have a relationship with the pain you may be having. Okay. So those are some things to consider in terms of sleuthing down why you may have pain. Now, other reasons you may have pain too, which we covered in the first session about addressing pain, is sometimes sitting in awkward positions or standing or being in awkward postural positions can actually put a slow burn on the ligament structure. And you may not know that that was a cause because you may not have pain until a couple of days later because ligaments respond slower to injury. That could be the reason why a person may have knee pain or shoulder pain because they were working in a sustained awkward position. And the body caught up in terms of telling it that that's what happened. Okay. Okay. Lifestyle interventions. Recommend patients incorporate a safe, appropriate exercise program. Movement helps immune system. So a few of you have already mentioned how exercise, you appreciate exercise in terms of helping with your well-being. But movement helps your immune system. Basically, your lymphatic system is stimulated by movement, by movement. And when that happens, then it helps to, you can say, get debris out, inflammation out of our system because things are moving. And you can say when you wake, some of us wake up in the morning who've had severe pain, but as the day went on, the pain went away. That's because the lymphatic system started getting engaged because you were moving. Posture exercise, every morning I'll do a posture exercise in terms of maintaining a vitality consciousness, but it's simply standing against a door with trying to get your head, your shoulders, your hips, your calves along that door for a few minutes at least. And that might seem such a static type exercise, but it has a tremendous dynamic effect on your system. That's one of the exercises I did to help get over my hip pain. Optimize sleep to reduce immune reactivity and adrenal response. So sleep is real important for rest recovery and something you've heard about blacking out your room as best as possible, but sometimes that's hard to do. So I've discovered these eye blockers called Viva Rays, and they're more than just eye blockers. They actually cover over your eyes without pressing on your eyes, and it blocks everything out. So if you can't really darken your room, this is the next best thing to help with optimizing your sleep. Guide patients to practice stress management techniques to reduce the potential for stress-mediated low-grade inflammation. So stress, again, can stimulate your sympathetic nervous system, cause more acidity in your system. So for all of us, we want to address stress in healthy ways. So two ways I've been claiming or proclaiming is using heart math, and we've talked a little bit about that so far, and brain tap. So brain tap is a app that you use that sends good sensory information, basic sensory input into your nervous system, which allows it to quell the nervous system. And there's various programs related to it. Okay. Diet, therapeutic diet and nutritional considerations to lower inflammation. So you may have heard of some of these things too, an anti-inflammatory diet or a Mediterranean diet rich in the following nutrients. Essential fatty acids from sources such as omega-3, cold water fish, salmon, mackerel, sardines, cod, tuna, trout, herring, as well as plant-based sources including walnuts, flax, chia, seeds, and hemp. So essential fatty acids, those are anti-inflammatory. Herbs and spices that contain anti-inflammatory agents such as allspice, cinnamon, cloves, rosemary, turmeric, ginger, and oregano are known to be anti-inflammatory. And they also make the food taste better. Fruits and vegetables such as blueberries, cherries, pineapples, oranges. Maybe you're getting hungry now. Strawberries, tomatoes, as well as Swiss chard, kale, spinach, collard greens, bok choy, and celery. So again, those are anti-inflammatory fruits and vegetables. Okay, therapeutic diet and nutritional considerations continued. Support GI health and gut ecology, where chronic inflammation often begins. So again, going back to vitamin D, with our gut health, if we really help our gut to be healthy, that goes a long way with reducing inflammation in our whole body. And now, for some of us, we might be vulnerable to joint pain, but for some of us, we might be vulnerable to sinus allergies or stomach problems. And a lot of that can stem from the health of our gut. Facilitate local GI and systemic short chain fatty acid production through a high fiber diet to leverage their anti-inflammatory properties. Okay, that's a little bit of a mouthful for you. So systemic short chain fatty acids. Now, if you're not familiar with that, that's what our body needs in order for our GI or intestine to repair and to fuel itself. And a lot of that comes from the production from eating a high fiber diet, which lends itself to anti-inflammatory properties. Avoid overconsumption of hydrogenated oils, particularly from corn, cottonseed, soybean, safflower, and sunflower. Okay, now a lot of those are in processed foods, and those of us present here, most likely you probably minimize processed foods in your diets, but just be alert. Processed food have a lot of these oils, which can be inflammatory. Reduce refined carbohydrate intake as excess sugar may exacerbate inflammation. So again, processed foods, but sweets. If we eat too much sweets, that's going to have an inflammation causing effect on our body. When in pain, eat a clean diet, especially. So there's an eating reset, a 14-day clean eating program, which I'm going to introduce a little bit later in our time here. But just to think about eating a clean diet especially when you are in pain, and then watching your limits when you're not in pain, so it can prevent the onset of pain. Habits and perspective from Atomic Habits. So I use James Clear work where he looks at, can one tiny change transform your life? It's unlikely you would say so. But what if you made another and another and another? And at some point, you will have to admit that your life transformed by one small change. Okay. So again, step by step, seeing what next step here. And then you might take a couple steps forward, then you might take a step back. Okay, that's common. But seeing what it takes to keep moving, you can say in an upward life direction, a life vitality direction. So reflection and review is a process that allows you to remain conscious of your health over time. This is where looking at in the evening and in the morning, reviewing your day, looking to see what you can do better, you can say diet-wise or lifestyle-wise or stress-wise. And then review. Again, in the Conscious Healthy Aging content, there's module 3 that really gets into how to stay on track with your physical well-being. Okay, that's a bit of a mouthful I just gave you, and I thought we'd just take a moment to just pause here and just to bring it all together, meditation, so we can just slow down our thoughts. And usually like to just have ourselves breathe together. And for right now, you may want to close your eyes. And if you have some heart math background, sometimes putting your hand over your heart area, if you're comfortable with that, and your left hand over your heart, your right hand over that, and sitting up straight. So if you're doing that with me. And then let's just breathe together. Breathing in slow and breathing out slower. As Mitch said, he does breathing exercises, but when you breathe in slow and out slower, it activates your parasympathetic system, which balances out that sympathetic system, which can slow down the generation, say, acid in your body. So breathing in slow and out slower. And then appreciating what we just shared. Some things may have locked in with you. Some things were maybe a little bit too much to lock in, but what can you appreciate of what we just shared? So breathing in, as we breathe in, considering the things that we just shared together. What made a difference for you, or what did you hear? Take note of that. And appreciate the community that we have here to support each other and to acknowledge. Actually share one-to-one or one-to-one with each other, but sharing collectively and affirming, basically affirming our vitality consciousness together, which can transcend in terms of making healthy choices, eating a clean diet, having a vitality consciousness individually and together. Breathing in slow, and breathing out slower. Just a couple more times, breathing in slow and out slower. Okay. Okay, good. You can release there, open your eyes if they had them closed. Let's look at this again. How we learn, let's personally consider now, just something to think of. We learn by reflecting on our experience, which is called a learning loop. So rather than what we just shared, kind of just going by the wayside, if we can reflect on that, there, we did a little bit of meditation on that, but then personally considering. So if you have pen and paper, or if you just want to reflect in your thoughts there, we learn by reflecting. So what insight has been most useful to you? Implementation follow through. So what we considered tonight, what tiny changes can you make to enhance your health and feel overall well? Appreciate your successes. Acknowledge the more of what it takes for healing and health. And getting back to what Ellen brought up, like appreciate your successes. Appreciate, for one, eating and in gratitude, or saying a blessing before you eat. And again, you may at times you may be squeezed for eating the highest quality food, or there's certain things you might like, but that aren't the highest quality that you eat with enjoyment, not in thinking, well, this is bad for me, but if in moderation, with a sense of gratitude, you can really enjoy certain foods that may not be thought as the highest quality of health. But it takes something more. And then review CHA content that comes to mind, again, with the content. And then just to go along with the CHA program, invitation to continue with Conscious Healthy Aging program, platform for yourself, if you're not a member yet, or those you might know that might be interested. The platform includes Conscious Healthy Aging core content, so you can acclimate to staying well as you age. Essentials for Well-Being core content, so you can affirm the essentials of well-being. And this is what we've done for the past year or so. And all that content is stored on the court site that you can access. Past and ongoing content to continue in the way of staying well as you age. Live interactive sessions to elevate your well-being and experience with others, like we've done tonight. Communication platform to interrelate and support one another between live sessions. We haven't really used that much, but it is available. To learn more and to gauge, you can go here, drsteveventola.com/vitality group membership. Contact me if you want to have a personal conversation about that. And then this is something here I've put together, or be putting together. It's an invitation to the 14-day spring into summer clean eating program beginning on June 3rd through June 17th. So this is late spring. Now, a friend of mine used to point out that in the late spring is a time to really plant seeds for, you can say, the summer, but actually the overall future for years to come. So it's an important time to take advantage of it. So this late spring that we're approaching, and June 3rd and June 17th is the bulk of that time. So program is administered through this Well World app. It's a Well World app that you can access on your phone and then sense it on your computer too if you need to do it that way. It includes a 14-day eating plan, which includes menus all spelled out, the menus, the recipes, shopping list, reminders, coaching encouragement, daily messages there. And it's complimentary for CHA members, and there's a special offer for non-members if you're not interested in joining the platform. So if you're interested, let me know soon, because I'll need to set you up in the program before June 3rd. So I have a date of May 30th be the last day to register for it. But if that strikes you, I'd encourage you to join in. Okay. And then for a CHA schedule, I find finding a pace for myself, you know, July, the next meeting will be in July, live session, August, then October, November. And a big part of my work is helping people find their flow with things, and including myself. So I've spaced out the times in that respect. So closing comments, questions?